The coronavirus pandemic is not only having an immediate impact in terms of the deaths of thousands of Americans, it's also taking more than a year off the average U.S. life expectancy. A new study published in the Proceedings of the National Academy of Sciences projects that COVID-19 will reduce U.S. life expectancy in 2020 by 1.13 years, with a disproportionate number of deaths occurring among Black and Latino populations. When combined with provisional estimates of U.S. death rates for the first half of the year, the data show a clear rise in the mortality rate as the pandemic took hold of the nation. Estimated reductions for the Black and Latino populations are 3 to 4 times that for whites. Consequently, COVID-19 is expected to reverse over 10 years of progress made in closing the Black-white gap in life expectancy and reduce the previous Latino mortality advantage by over 70%. According to the researchers of the study, Theresa Andrasfay of the University of Southern California and Noreen Goldman of Princeton University's Office of Population Research. Black and Latino Americans have experienced a disproportionate burden of COVID-19 morbidity and mortality, reflecting persistent structural inequalities that increase risk of exposure to COVID-19 and mortality risk for those infected, the study added. Prior to the pandemic, the U.S. had been making steady progress in terms of life expectancy, although it had slowed down in recent years. Life expectancy increased by nearly 10 years over the last half-century, from 69.9 years in 1959, to 78.9 years in 2016. After 2010, life expectancy plateaued and in 2014 it began reversing, dropping for 3 consecutive years, from 78.9 years in 2014, to 78.6 in 2017. Drug overdoses, suicides, alcohol-related illnesses and obesity were largely to blame for this. But the pandemic has set back all that progress, and also widened the gap between Black-white life expectancy. The Black and Latino populations are estimated to experience declines in life expectancy at birth of 2, 10 and 3.05 years, respectively, both of which are several times the 0.68-year reduction for whites. These projections imply an increase of nearly 40% in the Black-white life expectancy gap, from 3.6 years to over 5 years, thereby eliminating progress made in reducing this differential since 2006, the study added. Vemba-video equals Health. The 12th of January 2021, new data from the National Center for Health Statistics suggests that COVID-19 caused a significant jump in mortality in the U.S. The age-adjusted all-cause mortality rate was 769 per 100,000 in the first quarter of 2020 and rose to 840 in the second quarter of the year. Comparatively, the death rate for the second quarter of 2019 was 702 per 100,000, the NCHS said. While the report shows mortality rose significantly in 2020, it provides an incomplete snapshot of the pandemic since data for only the first 2 quarters are currently available.